stage itself, we take into the consideration the fire and the safety aspects for the people. And this is the one reason why we thought it's important, it's very relevant for hospitals to participate in these forums, because how to make safer hospital and more secure hospitals. Around 2 years back, my article was published on safer hospitals all over the world. It was appreciated because it talks about the concerns of fire and safety on that. Like to highlight, our hospitals practice the RACE concept of rescue, alarm, confine, evacuate and extinguish. We have a team of firefighters in each of our 65 hospitals. We recently started a state-of-the-art hospital at Ahmedabad Health City, which is a global super specialty care provider. All in line with the global standards for fire and safety are followed up there. We have a very energetic team in which we provide training to our team members and training on the type of fire, whether it is A type, B, C, D or E type of fire. You know there are different type of fires: solid fire, liquid fire, gaseous fire, metal fire, all the electrical fire. So there is a lot of sensitization which is done. And on the fire side, I'd like to highlight 7-pronged strategy we adopt in our hospital. First is that we have a full-blown fire plan, and around few years back there was a tragedy in a hospital, an AMRI hospital. A lot of patients lost their life because even it's more important in hospitals the fire concerns, because a lot of patients are bedridden, they can't move. So the concept of disaster management in hospital is very relevant and is very, very important, even more important than elsewhere. So this plan of fire plan in the hospital, then adequate training for the team and the mock drills which sir was mentioning in the beginning. This is something which we very rigorously follow on 3-monthly basis. We have display specific fire exit and evacuation pathways as safe exits for the patient, and lot of emphasis on signages, on the fire signages, in accordance with the national building norms and codes, maintenance of fire plans for the extinguishers. This is the one thing on which we emphasize a great deal, and this is something which we feel is one area on which lot of emphasis needs to be given, both on the equipment side as well as on the infrastructure side. We have firefighting equipments as well as sprinklers and lot of firefighting infrastructure which are enabled in all of our hospitals. So technology enabled fire and safety systems is the need of the hour, and this is something on which we all work and emphasize a great deal. We also have in our hospitals a special focus on the access control which sir was mentioning, with the latest CCTV systems and access control in which TV footages we follow towards giving patients safer hospitals. So this is something, the rescue equipment training on fire safety, which we emphasize a lot. I would also like to emphasize that we have in our hospital a safety committee. This safety committee looks into all the sub-verticals and the concerns of HIRA, hazards identification and risk analysis. This is proactively done in our hospitals to prevent any such eventualities. We have grab bars and various concerns so that the patient falls, and patient security concerns can be identification of smoking zones. When we started this campaign in our hospitals with the identification of assembly area, it was around 1 decade back it was started, and we Apollo hospitals are the pioneers in providing safer health care through the proactive approach on the infrastructure and fire safety. The identification of visitors, especially staff, visitors and patients, gives a 360-degree, because in hospital what happens, there are patients, there are staff and there are a lot of visitors. So these are the 3 verticals which has to be taken and integrated. As a part of CSR activity, we do lot of programs in community, and we welcome and we would like to partner with FSAI in future also for lot of community awareness initiatives in any of of our 9 hospitals. We have 2 hospitals in Visakhapatnam, 1 in Kakinada, 4 hospitals in Hyderabad, 1 Karimnagar, and 1 in Bhubaneswar. 9 hospitals which are reporting to me. And at that time, I'd like to announce this special initiatives on fire and safety in our new Erigova Health City Hospital. We will be shortly conducting a very big program on fire and safety with the help of Mr. Madhu, which we have discussed also. And like to thank all of you for giving us the opportunity here today to be present. My proud privilege, and surely will partner in a big way to take healthcare to the next level towards safer patient care, towards a care through which more patients can be saved, less accidents can take place through the risk avoidance. Identification of risk is a very important part when we talk to prevent such accidents. So it's not just that how when it happens fire, how we deal with fire. It's also a lot of awareness how we can prevent fire also an accident in the first instance itself. Thank you very much.